Good morning, everyone, and welcome to Great Day Houston. It is Medical Monday. Question: how many of you have a primary care physician? I think I heard a lot of you say you don't have one. Well, at Village Medical Primary Care, they're making it really convenient for you to establish that relationship and have a partner in your healthcare. And the thing that also makes it convenient, a lot of their locations are right inside of a Walgreens where you can do some shopping, go take care of your health, and if you happen to need a prescription, well, that's right back out the door and you can do some more shopping. All right, let's go find out what it takes and why it's so important to have a primary care physician. Dr. Johnson, I can't tell you how many times people have called me and said, hey, do you have a doctor? I have a sore throat. It might be strep throat, and I don't have a doctor. I'm like, why do you not have a doctor? This is one of the things that is the reason why it's so important to have a primary care physician.
Yes, definitely. If you have a relationship with a primary care doctor, a lot of things we can do because we have a relationship with you. John Smith calls me and asks me, so, well, can you call me some medication for this? I don't know you. I can't do that.
Yeah.
You know, but if it's somebody I know, I've known for years, and many of my patients I've had follow me for 30 years or more. And I've seen their parents and their children, and I know them. And so I'm comfortable taking their word for things and, acting on it.
Yeah, and there are a lot of people who will say, well, I'll just go to that little emergency clinic, but number one, that's costly. Number two, they see you for that moment. The great thing about primary care physicians is that you all are a partner in our health in a much bigger picture than just when we have a crisis.
Yes, I never think of one symptom when I see you. I think of your symptom and all your diseases, all the medications that you take. So I have to take that into consideration when I want to treat your problem. I have to think about the rest of your body too, the rest of your conditions together.
Yeah. You have a focus on hypertension and diabetes. Here's an example of why it can be so important to have a primary care physician. I was diagnosed as being, insulin resistant. And so the next move was, let's stop you from going diabetic. And that's what a primary care physician can do. Keeps you out of the specialist office and keeps you from getting even sicker in most cases.
Yes, we do preventive medicine and we do consolidation of care. You shouldn't have a fragmented medical team. You shouldn't have doctors all over town. You should have one doctor that you go to, and then I'll send you to a specialist once, twice a year, and I'll coordinate your care based on their recommendations.
Yeah, and Village Medical makes that so much easier. The convenience factor is great. Number one, a lot of your locations here in Houston are located within a Walgreens, which is kind of in a lot of people's beaten path. Mm-hmm. And then it can also help with, let's say, you don't feel good anyway. The last thing you want to do is drive all over town looking to get your prescription filled. It's just a few steps away.
Yeah, our agreement with Walgreens is by the time you leave my office, your medication should be ready. You shouldn't have to stand in line. You have preferential treatment at the local Walgreens, at the next door Walgreens, so you don't have to wait in line. When I send the prescription over, well, by the time we finish talking, your medicine's ready.
Yeah, the other thing that you help us to do, because this will, sometimes it's worse than the illness, is dealing with insurance.
Every patient has problems navigating the medical benefits with insurance, and we help guide you through that.
In terms of the services you offer, it's pretty comprehensive, starting with your annual wellness checkups. Now people will say, oh, I don't need a checkup, I feel fine. Whoops.
No. Once a year we need to review everything that's going on with you, and if nothing's going on, we need to make sure nothing's going on. Not because you don't feel it, because it's not there. We have to screen for things, we have to look for things, we have to find disease before it finds you.
Yeah, women's health services, you take care of that?
Yeah, I have a nurse practitioner, a female, that does my well-worn exams, and so you can get all that here.
Chronic care management, which if you already have chronic care, then you've got some issues. So let's make sure those issues don't become bigger.
Yes, definitely, and we continually readjust medications. The older you get, you may need less medicines, you may need more medicines, but your medicines change with age, so it's not like one size fits all.
What diseases are relatable to chronic care?
Your diabetes and your high blood pressure, number one and number two. It's going to affect every organ in your body. And we have to make sure they don't get eye disease, kidney disease related to these problems.
You do routine lab tests here?
We do the on-site here. When I order tests, we draw the blood here, we send it to the lab, and then you can see your results in your portal online with notes from me in a day or two.
Yeah, and seeing them online, that's 24/7 account access, right?
Yes, definitely.
So what you all are really doing is kind of playing to the modern way people need to access medication and what's conducive to them actually signing up and coming in and being a partner in their health, even down to the point where it's just a very pleasant atmosphere here. At the end of the day, to get people to go ahead and at least make the step of knowing who your primary care physician needs to be. You don't have to come in for an appointment right away, but make sure you set up that relationship so that when you're ready to come in, you know where to go.
Yes, most insurances ask you to pick a primary care doctor, and most patients have not even done that. And then when they do they don't know who the doctor is. And so you come in, you meet your primary care doctor, establish a care plan with us, let us go through and evaluate you and make sure you don't have anything. Just because you feel good does not make you are good.
Yeah, and then as you mentioned too, it's nice to know where you started, and then you can take us all the way through where you end up, because we have, we come in as young adults, but you can take us through our elderly years as well.
That's right. That's right. I take you from age 16 on up.
That word partnering really means a lot. I think oftentimes we'll walk into a doctor's office and say, here's my problem, you fix it. You want to have a conversation with us and figure out how we can best fix it.
Yes, I'm going to tell you what I give you my recommendations, and you have to tell me how that fits in your lifestyle and with your goals of life. I mean, some things are more important. I want to make sure that your goals in life are a priority too. Sometimes the treatment plan, the healthcare plan, is not conducive to the patient. My patients are elderly, they're on fixed incomes. Sometimes they have to make a decision between paying the utility bills and paying the medical bills. Well, if that be the case, I need to adjust the medication so that they can afford both medicines and utilities.
All right,
okay?
Dr. Johnson, thank you.
Thank you. Thank you.
Village Medical has over 40 locations in the greater Houston area, with 23 offices located inside of a Walgreens. To book an appointment or to learn more on how you can stay well with their customized healthcare plans, call 713-589-3840. Again, that's 713-589-3840. You can also visit them online at villagemedical.com.